Good evening. I'm Laura Dobrowolski, Executive Director for the International Association for Refugees Canada. Our mission at IAFR is to help people survive and recover from forced displacement. We do this globally by partnering with national organizations who specialize in refugee recovery work in their own context. The COVID-19 pandemic has disrupted all facets of life, causing millions of deaths around the world and leading to human suffering, economic recession, restrictions on human mobility, and severe limitations on daily life. But people who have been forcibly displaced were among the hardest hit groups of society, facing increased food and economic insecurity, as well as challenges to access to health services. Through our partnership in Malawi with There Is Hope, we were able to respond in collaboration with Health Partners International Canada to healthcare needs on the ground at a very critical time in the Dzaleka refugee camp. Through your generosity, HPIC provided 2 shipments of medicine and medical supplies worth over $200,000, providing essential supplies to the clinic. As you will see through the eyes of our partners on the ground, the intervention of donated medicines through HPIC this past year were life-saving.
Dzaleka Center caters for 70,000 people in our catchment area, that is including refugees and Malawians. Normally, as other health centers, we were not spared, so to us mostly it was of drug shortages. Of course, denial of or acceptance of the pandemic was also crucial, but to us that affected mostly was the shortages of drugs.
Remembering how it felt when we took the first donations, it was just unbelievable. I felt like I have achieved what I was meant to live for. It was just heartwarming, and to hear the stories of how that medical equipment and support helped, it was just unbelievable.
We received about a good number of antibiotics that we also helped when we were prescribing for respiratory infections for our patients, and also asthmatics. You know, the donations, of course, it came in 2 times, but most of the times that the donation was coming, it was during the cold season where asthmatic cases usually happen, so it mostly benefited us.
Naturally, refugees in a setup like Dzaleka camp, there have always been challenges in terms of access to healthcare services. One has to do with the availability of the services itself, which are quite limited. This donation came at the right time when we didn't even have resources to provide for COVID-19 preparedness and response. We hope the Canadian government and the Canadian people will continue to support us in terms of providing such donations, which will enable us to save more lives.
The year 2020 will be remembered like no other. In the context of refugees, despite all of the COVID-related movement restrictions around the world, displacement continued to occur and to grow. Globally, at least 82.4 million people have been forced to flee their homes, and the majority, some 86%, are hosted by developing countries such as Malawi. The need for primary health care within refugee camps is pressing, and it's the reason why HPIC is such an important partner for us as we seek to help people survive and recover from forced displacement. Now, more than ever, we are grateful for this partnership and your commitment to restoring health in the Global South. Through your generosity and support of HPIC, you are enabling critical care to some of the world's most vulnerable communities. Your continued investment in HPIC will bring health and hope where it is most needed. Thank you.